we've certainly we've heard a kind of a wonderful, exhaustive, and in some ways depressing set of lenses on the problem, but really hopeful ideas about where the solutions would come from. It's a little depressing at this hour, given what's going on with the auto bailout, that no one's talking about adopting the General Motors production system to improve health care. We heard a lot about the Toyota system, and there's something a little sad about that, I suppose. Just quick, why don't we go, Carl, why don't I just start with you? I mean, both you and Lois talked about the impact on small business and entrepreneurialism, and I think that's something that gets underappreciated in the debate. What do you think it will take to get more traction so that the salience of the economic impact on innovation is something that becomes top of mind for our policymakers? Carl, you want to take a first crack? And then, or Lois?
Your small business.
Well, I think that the case just has to be made in more human and more concrete terms, and it's got to be made by business people, and that's why I think the work that CED has done in bringing this together in these kind of forums is important. And I think that moving beyond, most people don't see the status quo as a realistic alternative anymore. And I think that has to be heard. It simply is making the case more effectively. I'm actually very optimistic that we can do something really uniquely good here. I think that in this country we have the elements to have a healthcare system better than anybody else's in the world. And you can see that in the innovation that we've got. You can see that in the strengths of programs like yours in Denver that have cared for low-income people. You can see that in so many ways. But we do have to make some changes to get us there. And I think that we need to understand the problem in the kind of really clear way that the McKinsey report lays out, understand it in the human dimensions, and then say simply this is clearly not a problem that is bigger than the American people, and let's do it now.
You know, if you talk about your tyranny of dead ideas, the concept that we have the best health care in America, and then you match it up with the concept that we have some of the worst total system outcomes in the world, is something that we've not reconciled in public conversation. I do think that that both of those are simultaneous truths. If as an individual with sufficient resources you access some of the better systems, there is no better health care obtainable. As a total country, you have life expectancy going down, you have the percentage of non-covered going up, you have disease and so on running increasingly rampant. We have to acknowledge both of those statements and not view them as in conflict with each other, but that they are and statements, not or statements, and it becomes politicized. And then we do let it get down to, as we were talking earlier about in the day, well, I don't want to lose what I have. Healthcare is somebody else's problem. We've not managed, I think, to talk about the broader implications of the healthcare debate. We don't talk about job loss. We don't talk about non-business creation. We don't talk about lower life expectancy.
Very good thoughts, important thoughts, Carl. Let me, on the provider side, just to pose a quick question for Dr. Wolter and also for Dr. Gabo. What, providers are obviously critical in all of this. Do you have, if President Obama or Tom Daschle were asking for your, what would be the headline of your counsel to them on how to engage providers in a way that hopefully leads people to come to the table in a spirit of maybe everybody's going to give something so we all end up with something better? How would you encourage them to try and shape that as a constructive dynamic?
This reminds me of a time I was in front of the Senate Finance Committee, and Senator Baucus said to me, if you were the czar, what would you do to make the Medicare program perfect overnight? It's hard to answer a big question like that. But I guess I would say that we were talking earlier this morning, I think we need to make it very, very clear in the healthcare reform effort that we are going to create systems of healthcare, because we cannot solve the cost and quality problems without there being systems of healthcare. And I think about my development as a physician. I mean, there's some dearly held beliefs that we kind of grow up in as we become physicians. One is autonomy. The other is that by ourselves we define quality as it applies to patient care. And yet we know very well now that it really is system approaches to safety or eliminating defects or providing value that deliver the results. And so the fragmentation of the healthcare system that has really been the hallmark of American healthcare over many, many decades has to change. So if HHS Secretary Daschle were to announce that payment policy will very quickly incent models of care that we know can deliver the goods, like Mayo Clinic, Intermountain Healthcare, et cetera, we'd see fairly rapid change in this country.
Dr. Gaber?
Well, I would agree that my grandfather always said, "My girl, money talks," and I would agree with what you say. If you create bundled payment or coordinated payment models, physicians will go to that. But I also think that physicians still are driven by wanting to do good. And if we can show in a articulate manner that care for the patient in the integrated system is better, has better outcomes, will permit physicians to have the HIT support that they need to both manage quality and costs, I think we will see movements to integrated groups. I also think the carrot that could be put on the table is relief from regulatory burden. By being part of an integrated system, if that integrated system, in fact, got relief from regulatory burden, because I think that is something that physicians would be willing to trade.
Let me ask Lenny Mendonça then a last question before we go to the audience's questions. And Lenny, just thinking about business people in the room and those who counsel business people, often there's a sense that business leaders feel a little reticent about entering the public square on these issues and wonder if it's worth their time and effort to try and move something when Washington can seem difficult and incomprehensible sometimes. What would you say to folks as they're thinking about, and to business folks in particular, about how they should think about their role in the coming debate?
I'd start with, you're right, Washington is indefensible and ununderstandable, if that's the phrase you used. But that doesn't mean you shouldn't get involved. As the numbers that I said before, at $150 billion a year of excess cost that's being paid by the employer system, that's a material number. The average Fortune 500 company will spend more on health care benefits than they will make in profits this year. $650 billion, when we keep throwing around very large numbers in all other arenas, feels like I can't comprehend the scale of that number. But just to put that in perspective, that's roughly the size of what the president's stimulus package is in round number terms, or at least the president-elect's proposed numbers. That is a excess cost that's borne every year. So effectively, we've got a destimulus on the economy that employers are paying a large portion of, that's holding back employment and other benefits every year. At $650 billion a year of excess spending, you could cover every uninsured person in the country. You could cover the entire state and local deficits for the year that are projected for the year ahead. And on top of that, you could get every citizen, every family in the country, a $1,000 rebate. Those are real numbers. So when asked about why business leaders should get involved, it's in their economic interest. That's the engine of growth of the country, and they need to be engaged if we're going to see something